What are myeloma targets?
It specifically pertains to the mechanism of action of a drug, and the target usually is what the drug engages in its attempt to kill the myeloma cell. Now, the target could be something on the cell surface, and that is commonly the target used for immunotherapies like antibodies or antibody drug conjugates, or many of the newer immunotherapies like the bispecific antibodies and CAR T cells. So these are again antigens that are expressed on the cell surface or the cell membrane. Now, similarly, there can be targets that are present within the cell, and those are usually targets that have a specific function. So it might transmit some of the signals that are needed for the cells to divide, or it might be some of the molecules that are responsible for keeping the cells alive. So if when you use that drug which targets one of the small molecules or some of the intermediaries of the cell function, then it can lead to cell death. Now, a good example of that could be one of the approved drugs like selinexor that targets a specific protein that exports or what we call a nuclear transport protein, and it inhibits its function. We have something called a drug called venetoclax that are going through clinical trial, and that specifically targets a protein called BCL2 that is responsible for keeping the cells alive. And by inhibiting the BCL2, you are able to kill the myeloma cells that are highly dependent on that BCL2 function. So the target could mean different things in the context of the specific drug that's being looked at. The ones that are outside are often used for immunotherapies. The ones inside are often the targets for small molecule therapies.
What makes something a good target or a bad target?
A target that is specifically present in the myeloma cell compared to normal cell would make it a better target. So when you talk about targets that are present on the cell surface or the myeloma cell membrane, for the immunotherapy approaches, we are looking for targets that are uniquely present on the myeloma cells and not present or present at very low levels on the normal cells, so that the treatments can be specifically targeted towards the tumor cells. Now, for most of the targets that we have, the ones that tend to be more unique are the ones which are used in the immunotherapy that are present on the cell surface. Many of the other targets that we have within the cell often tend to be involved in normal function as well, but often the cell might be more dependent in the setting of the tumor. So the tumor cell may rely more on the target compared to a normal cell, and that would also be a good target.
What targets are currently being explored in myeloma?
So there are a variety of different targets on the outside of the cell, which include some which are already in the clinic, like the CD38, which is a target for daratumumab and isatuximab, SLAM-F7, that is the target for elotuzumab. There is the BCMA or the B-cell maturation antigen, that is a very favorite target because it's quite uniquely present on or predominantly present on the myeloma cells. That's target for antibody drug conjugates like belantamab and also for the CAR T cells, both approved and in development. Now, there are also targets within the myeloma cell that are being explored. So, for example, we talked about venetoclax, which targets the BCL2. There are other inhibitors that's targeting MCL1, which is another member of the same family and responsible for keeping the myeloma cells alive. There are targets that are going after what we call a MYC, which is again a protein that is often responsible for, again, cell survival in myeloma. And the hope is that by going after these molecules which are critical for the cell function, and especially targeting more than one at a time, and targeting the ones that the tumor is more reliant on, we are able to preferentially cause the myeloma tumor cell death and not affect the normal cells.
Can myeloma cells lose a target?
The myeloma cells can certainly lose a target, and it can be an actual loss of the target, which could happen, for example, with the BCMA, which is again a good target for a lot of the immunotherapies. And some recent studies have shown that there can be a loss of the gene that codes for that protein. So the myeloma cells actually will not express any BCMA. So the immunotherapy will not work. Now, there can also be a relative change or a relative loss. A myeloma cell that is more dependent on a BCL2 for survival can switch its profile to become more dependent on MCL1. So a drug that targets BCL2 is no longer effective, and you may have to use a different drug that targets the molecule that it is more dependent on now.
What is NY-ESO1?
NY-ESO-1 is one of a whole group of antigens called cancer testis antigens that are expressed in testis cells and in fetus cells, fetal cells, and probably play a role in early tissue growth and development. They are then largely shut off in the adult, in adult tissues, but they find their way to be re-expressed in cancer cells, where they may be co-opted or used by the cancer cells to bring about growth and proliferation and survival of these cancer cells. They are a relatively special or unique type of cancer marker, cancer antigen to go after, because they are relatively selectively expressed on cancer cells and absent on adult tissues. And so if they are made to be the target for cellular immunotherapy, they will enable the genetically modified or these engineered T cells to be able to go after the cancer and leave the normal surrounding tissues alone. NY-ESO-1 is one of those cancer testis antigens that is expressed in advanced myeloma, refractory myeloma, but also on some pediatric cancers such as synovial sarcoma.
Is NY-ESO-1 a target on the outside or inside of myeloma cells?
So NY-ESO is an internal antigen that is expressed really only in embryonic cells, very primitive fetal cells, and also cancer cells, including myeloma. They often get re-expressed or turned back on, but they tend to be more internal, but then the cell will break them into little pieces and express them on the surface.